when you're going to do scapular mobilization, there's lots of positions that you can put the arm in. I'm going to latch your arm down. There's lots of positions that you can use. One of my favorites is to allow their arm to just kind of rest over mine, and then I use their elbow kind of right in my gut to help move them around. So for elevation depression, you're just going to come inferior angle, superior part of the acromion, and you're going to move them up and down. You're going to tweak your hands a little bit and go to that vertebral border and the anterior part of the acromion to do your protraction, retraction. And if I needed to get a little more force on there, I can use Caitlin's humerus like a lever. And then especially when you go into winging, you're going to put them right there on your fingers underneath that medial border, and then you use their humerus to push on, to push their humerus, or excuse me, push their scapula over your fingers. Front hand kind of stabilizes, and then you can wing them. Right? I know you learned last year, you learned to do it here, right? And you did all your scapular mobilization here and your winging here. And it works beautifully. I mean, look how much easier I can wing from here. What I'll tell you, though, is that the vast majority of your shoulder patients will never, ever get here. You know, maybe their very last part of therapy, you might have them this mobile, but they will not get here. So you need to learn to do this from other positions. Another way that you can do it, and for people who are a little weird about having people touch them, you know, bring the pillow in, or you can have a patient kind of loop over the pillow, and then you can be here. And this actually works better for Caitlin.
That looked painful.
It does look painful, but
Fix the table. Probably my old bones are more likely to be creaking than hers.
How much do you know when to pull and how much force to use? I mean, it looked like you were getting a good grip in there.
Yeah, because she's pretty
Separate.
mobile. She's pretty mobile, so it depends what they have.
No.
A lot of this is very adaptable to your patient and what they give you, how much flexibility there is, how much discomfort they have as you get in there. Some people will guard a lot when you get in there, and then it's a little harder to get in, and that's because they're tight, because it's painful. And so how much pressure you use, how much force, how much you pull away depends on that patient. Sometimes you can't get under there at all. A lot of our shoulder patients, their scapular muscles are really tightly, they're tightened up, and there's a lot of muscle guarding in them, so that scapula is pretty tightly bound to the thorax. So I may do nothing more than just come under there, whatever I can get, and do a little bit of friction massage. I showed the first group this morning, and this won't be real effective on Caitlin, but I showed them an ART technique. It's active release therapy to the subscapularis, because it tends to get very tight. Remember, subscapula is on the anterior surface of the scapula, and it will really limit that ability to get up underneath there. I'm going to flip on your back for me. This won't, she's pretty loose, so we're not really, this won't look like much on her, but if you have patients whose scaps are really tight, they usually lack some elevation of the arm. Not an issue. Right, but what you do, take your thumb, and you're going to find that axillary border of the scapula with them in a fairly short position. I'm going to find that axillary border and I'm going right across the top of the scapula. So you want to get on that anterior surface if you can get in there. And then you have the patient elevate the arm, and that's going to put that muscle on some stretch. So you bring it down into a more shortened position. Come up over this one. Up here, right? Over the top of that.
Now, are you digging your thumb in there, or?
I am. A lot of my patients I can't get even close to being in there. She's loose, so I can I can come right across the top of her scapula, no problem. And you would see, if somebody who's tighter, you're gonna see, you'll get them, you know, like to here, and you'll feel a bunch of resistance under your thumb. So you know that muscle's being put on stretch. And your thumb is there to kind of isolate a stretch position. You're isolating that spot in the muscle to add a little more stretch to it.
how much
So you
pressure you
work
use?
your way. Again, it depends on the patient, how tight they are, how much pressure you use, how much they can tolerate. I have people that are so uncomfortable there that as soon as you know, so many muscle trigger points that as soon as you go to push in there, they're jumping. So I might use a very light pressure on them, especially the first time through. Maybe nothing more than, you know, just putting my thumb there. Somebody who gets a little looser needs a little more pressure, so I'm gonna get in there and push a little bit more to get that tissue to release. Some people know they lack some scapular mobility and some. You wanna do it real quick? Because you won't see it. Caitlin, you're not gonna see it any difference as we do this.
You want me on my back or?
On your back. We did this on Danielle this morning. She gained about 20 degrees of range of motion in her shoulders after we
Yeah, it's
finished.
pretty much right there, it hurts.
It hurts too? Okay. Side towards me just an inch. Move that arm up and over your head. Good.
It just looks like it hurts.
It does.
And sometimes that muscle will be so tight that my thumb will shake as they move into that range of motion. There's so much resistance against my thumb that it'll make my thumb start to shake. I usually do 3 passes with this. First time through is going to be the most uncomfortable.
Tell them to breathe.
Yes. Yes.
Can you count for us now?
And if it's really uncomfortable, you can have them exhale as they come up into that stretch position, so they're not holding their breath.
I figure still my breath's
And
about
then
passed
say,
out.
then it'll feel better.
Will you manipulate your thumb around it?
Yes, my thumb's coming like right up, if I can get it in there, right on the top of the scapula, the anterior surface. Because some people will be so tight, all you can do is kind of get onto the axillary border and try to come up over the top, but you won't get in there at all. Just a little more comfortable this time through.
Mhm.
And you can see his arm coming back a little more. So we'll do his 3 passes and then show you the difference in his range and ask him if it feels any better. This is a post-grad skill, but it's very effective. So I will show you